Wonderful. Well, as you know, it's Monday here at Tropical Nomad. It's the first Monday of every month. So what we do with that is we have this beautiful collaboration with Health Hub Bali, our sister Tracy over there from Australia, who's been here for many years, and developed this wonderful platform called Health Hub Bali, which we'll get into a little bit later on. And tonight is a very important episode, as they all are, but tonight is very important. And it's about, how does Bali, in an integrative model, deal with cancer, this cancer initiative. So we're going to talk about that pretty soon. But just before we do, just want to let you know that every Monday we're here. If you'd like to come and join the studio audience, you can do so at 6 p.m. and we go live about 6:25 or 6:30. And you're welcome to join us online as well. We're online in both Facebook, Instagram, and YouTube. I think YouTube and Facebook are the best viewing experiences. So my name is Robert Ian Bonnick. I'm your host, founder of SpeakuP Monday and founder of RIB and Associates, which is a growth strategist in Indonesia, also a gateway to Indonesia for foreign companies wanting to enter and grow, and for domestic companies wanting to grow in Indonesia also, in about 10 different industries. But tonight, I'm excited because, again, this health part, people come here to Bali, they want to feel safe, they want to know that they're looked after. And in the other episode where you featured Dr. Patra, it was great because I think we gave a really good understanding of the infrastructure that is here in Bali. We have a great understanding of these three models of, medical tourism, health tourism, wellness tourism as this integrative model. And we spoke about this whole health model that Health Hub stands for, and obviously working together with government to fill in the gaps to create this wonderful service that we're all moving towards. So I think, what would be great, so everyone here can get a good idea of who you are, is just one by one, just to introduce yourselves, and after that we'll get into the questions. Thank you very much.
Okay, thank you, Robert. Nice to meet you again. Yeah, so everybody, this is the second time we are talking, I myself talking in this event, and I'm complete name is Gede Wiriana Patrajaya. I'm a Balinese people. My background is medical doctors, but especially for the hospital management administration. Yeah, now I'm as a chairman of the Bali Medical Tourism Association. This association we built because we would like that the infrastructure, the potential of the health services in Bali, we would like that it's either will be make like a joint operation, because as you know that in Bali maybe the hospital, the biggest hospital is Sangla Hospital with 700 beds. The other hospital around the bed is 50 until 100 beds. But every hospital, we looked at, we push them, they have the center of excellence. Yeah. So this time we were talking about the cancer care. Yeah. Because before, maybe in the first event, we are talking about the future of medicine. What Robert said, that in Bali we would like to combine between the medical, the health, and the wellness. Yeah, I think that's all for my what is that somebody would like to know about me. Yeah, thank you.
Thank you very much indeed, Dr. Patra. And Dr. Oka, welcome to the show, the first time for you, and not the last.
Yeah.
Please, look at that smile. He's coming back. He's coming back. Over to you, Dr.
Thank
Oka.
you, Robert. Good evening, everyone. My name is Oka, Dr. Oka. I'm a medical doctor and also right now as a CEO of Ari Canti Hospital at Ubud. So from last year, from July 2023, we start traditional medicine in hospital. So we have three ways to make this project. First, we start traditional clinic, and then this right now we start how to integrate traditional services with conventional medicine. And then the last step, we will do research about the benefit of traditional practice on conventional treatment like that. We will do a project for metabolic disease. Right now, we start the slimming journey, the weight management program, how to help people to get wellness before they jump to the metabolic disease like diabetes, hypertension, like that. So we stop the process, do the project. Then this project collaboration from the doctor, internist doctor, clinical nutrition doctor, and also traditional medicine. We use herb, we use sport, and also we use breathing technique, like in Balinese technique, yoga from Balinese technique like that. So in the next, we will open the collaborative treatment for cancer, joining conventional doctor and traditional doctor. We will start club from cancer, people after operation, people with chemotherapy. So join the club, and we will do practice with asana, pranayama, and then also herbal for help them how to improve their quality of life after diagnosis as cancer like that. Yeah. In the future, we will start the senior living place near hospital. Right now, we have a senior club from the people around the hospital, 108 people, senior. They come twice a month to visit hospital. We do yoga ketawa, laughing yoga. We do for dementia exercise like that, and do medical checkup, simple medical checkup. Many more activity, and also traditional technique. In our hospital, we start acupressure. In Balinese also we have scripture patok, totok for acupressure, acupuncture, herbal, taru pramana, and then massage. We also give offering to them jiwa pramana, how to do meditation using few technique, like maybe anulum filum, nadi sudi pranayama. We this technique mentioned in Ganapati Tattva, one of our ancient scripture of yoga in Bali. So we will upskill the technique, and then we will do the research how this technique benefit to balance your system, sympathetic, parasympathetic system, and then balance your hormone, and then reduce the inflammation process, and then you become well like that. That is the project we just start from last year. Thank you.
You know, that is, I'm smiling on the inside and on the outside. Also laughing yoga. Now I know why. You see that smile. Patra as well has got an incredible smile, but the laughing yoga, now I know why.
Laughing make you hell,
Yeah. And I mean, look, before we pass to Tracy, the things which come up for me that I'd love to share with everybody is that this is really, it's very unique, right? So lots of people reason for it. And then when you look at the Balinese beautiful culture, one of the only living cultures in the world, then you can see how one locks the other one in, using ceremony, using all of these that you've just mentioned now to maintain the balance. Maintain the balance. So all of this, you have an incredibly unique place, which is Bali. And so the whole point then is that instead of doing health treatment remotely, come to Bali, right? And then come, again, Tracy will explain what Health Hub Bali is doing, but the point is West meets East. So what happens is that, you'll come in and you will have, these measurement devices at a hospital or at the clinic where you can actually find out exactly what's happening in your body. So you get a really good understanding of, this is my diagnosis. So now when it comes to the prognosis, what do I do with it? Then you have West meets East. So you have all of these different modalities, Western if you want to go that route, or Eastern. right? The laughing yoga, the pranayama, the breathing, and everything else, which can then allow you to reclaim your own health. So in the same way as when your system is working beautifully, if you cut yourself, you heal. Because your system isn't overloaded, it's working in a beautiful, maybe a homeostatic state, right? It's working beautifully. But then when your mental, emotional, physical, spiritual, these things start to come in and you begin to experience dis-ease, that's when, if you cut yourself, then it no longer heals itself. And this is where the body needs support and needs help through these different modalities and different systems to bring back wellness into the body. You know, so when I hear both you, Brother Dr. Patra, and Brother, you're now brothers, right? You were a brother before. Brother Dr. Oka, you know, again, I didn't hear what he had to say before. It's the first time that I've heard it. Yeah. But just to hear all of those, that's incredible. That is, and again, I'm not Balinese, obviously, but that's the thing, you know, Bhinneka Tunggal Ika, the motto of Indonesia is unity and diversity. It's this. So everything is just coming together, West meets East. Yeah. And then obviously with Tri Hitakarana, which I absolutely love, a Balinese philosophy that is incredible, then again, all of these things work together to create this incredible wellness, healing, medical place that Bali is. So maybe I've stolen a little bit of Tracy's thunder, but I just wanted to pass that on just so you might maybe get a bit of context. So Tracy, over to you. Where we were was a little introduction into who you are, what role you play, and obviously Health Hub Bali, and anything else that you want to add to it.
Good evening. Thanks for joining us this evening. My name is Tracy Grunewald, and I'm here with Health Hub Bali. I'm the founder of it. And the purpose of Health Hub Bali is to connect people to better health. And how we do that, it's an integrative model with a functional medicine entry point. So that's why we start with the medical side, then we go health, and then to the wellness. It's a health tourism venture, so that means that when you come to Bali, it's about putting a model together on the road to life. So we either have two people coming to Bali, they're either what we call health seekers with some kind of health issue, or what we normally call like vitality seekers or longevity. And we say that there's a big difference. There's been some conversations recently, why not go to Singapore or these other countries, Thailand or Kuala Lumpur? Why Bali? So that's what we'll talk about tonight. What is the difference that? Why Bali? And why not Bali at the moment? Why not Indonesia? Why are the Indonesians going to these other countries? And what we as a collective can do to upgrade everything.
And just for those which, I'm a lay person, happily so. So I like to kind of explain things in a way that I think I would understand. So I'm not the smartest person in the room. I'm usually the least smartest in the room, and I'm happy to be that way. I learn the most, right? So functional medicine. Everyone knows what functional medicine is? Just raise your hand if you know what functional medicine is. Good. So Tracy, you want to just explain what functional medicine is?
Do we know what functional medicine is?
Yes.
Dr. Patra, my brother, help us.
We're together. We have it, yeah. So if we looked at, because I'm a medical doctor, before I'm study, before medical, we call that medical conventional, that the people come, they feel something, and then the doctor will be examination, and then make a diagnosis, what is the disease, what they have a problem with their health, like this. After that, they will be give a medicine, yeah, and continuing until that maybe the disease will be disappear, or maybe they feel that getting better. But the functional medicine, this is I think that not new concept, but the concept is now is growing up, yeah. Because before I'm study for the disease, we have study for the function of the body, yeah. We call that physiology and etc. Like this. What is why we have skin? What is the function of the skin and eyes and etc. All of our body. We study it. So now the functional medicine would like to know why the people sick. So what is the system? What is maybe the the hemostatic, the organ that have a problem. So they would like to increase the quality of the system or organ that have a problem to make that the people to be sick like this. So we looked at this is I think that more completely, because medical is arts and science. So this is the doctor must be in the future not only thinking, okay, this is the patient, they have problem with maybe their heart and etc. So to elaborate again, what is the cause, why they have a problem with their heart and etc. And not only thinking the medicine, but the lifestyle of the people. So this is, I think that's more completely, more advanced than before I only thinking about the disease like this. So this is my opinion for the functional medicine.
You know, and it's so powerful because, you know, as you mentioned, you know, in the West, I was born in London, and, you know, if you get a headache, you know, you go to the doctor and say, I've got a headache. He goes, take this tablet, right? Okay, I'll take it. And then my headache comes back the same time next day. I go back to the doctor, goes, take another tablet. Now, you don't have to be smart to realize this is not going to work out well. Whereas what I love about what you're saying about functional medicine is that it's going to the core of what's causing your headache. Which system is causing your headache? And then once you know why it exists, then you can address the cause as opposed to just treating the end result, you know, which I love about the way you phrase it, you know. Love that. So now I've got some questions. So I've written them down on very large type. But if I did this, you could probably see them and read them out for me. So this will be the three questions to our esteemed panel. So question number one is, so Bali's integrative medical infrastructure and initiative for better health 2024, meeting international standards, staffing, focusing on vitality, longevity, cancer care, options, Usada, traditional medicine, integrated into the health tourism model for whole health. So the question then is, for the people which I don't think came before, is, you know, what is Bali's medical or integrated medical tourism infrastructure? So what is the infrastructure that's in place in Bali now that supports this this integrative model of treating cancer?
So we would like to inform now in Bali we have 76 hospitals. But like we have in Indonesia classification of the hospital. A class, it means that the highest. We have one for the general hospital and two for the special hospital like this. The other is B class and C class. Mostly C class. What I said before that, now our members for the Bali Medical Tourism Association, we select from the 76 hospital. There are 14, but they add with Ari Canti, so now 15. That this hospital have a center of excellence. Besides they have a general hospital, they have a center of excellence. So there is a center of excellence for cancer, for orthopedic, for eyes, and etc. like this. So special for cancer, we looked at Ari Canti would like to implement it, to integrate it between the medical, we call that a Western medical, conventional medical, with the integration with the traditional Bali medicine. So before I have make a workshop in Ari Canti and with the expert not only from Bali but from Jakarta, from India, Malaysia, and etc. coming, and they agree that Bali have like opportunity or potential with the infrastructure that we have now in Bali to make a program integrated functional medicine for the cancer. So this is a thing that, because we know that for cancer, for example, there are many modalities for treatment. But mostly the people only know about the chemotherapy, radiotherapy, operation. So we have information there is the other modality like hyperthermia, ozone, and then the nutrition and etc. And we are in Bali, we have, maybe Dr. Oka will be explain more, that we have to support that the people, because in cancer, about the psychologic is important. Yeah, like this. Yeah, so in Bali we have like the way how to increase the inner power, and then about the spiritual, about the psychological, and etc. So this is, we hope that, because medical is arts and science. So the doctors who responsible, who as doctor in charge in this patient, they must be knows about the modality. And then the second, this is the arts of the doctor, will be combined between the medical conventional, the traditional, including like make integration, combination. This is doctor have like the arts and science to make treatment for the cancer. Yeah, okay, I think.
Dr. Oka, what would you like to add to that? Because you mentioned that you would elaborate on some of those points, so feel free.
Yeah, I will give more information like this. We start from Balinese ancestor understanding of our body. In Balinese term, paradigm, we understand our body as a 5-layer body. Yeah, physical body come from food, from the soil, from the water, and then the prana body. From breathing, from the air, and then sukshma body or mind, mental, emotional layer, and then after that intelligentsia and also happiness body like that. From this 5-layer body, only 3 layer always sick. Physical body, prana body, energy body, and also mental, emotional like that. So in our tradition, we have such as dancing tradition, how we dance. We have 5 category, 5 benefit from dancing. First, viraga, how our body move and then make better metabolism of our muscle, our hormone. Viraga, raga mean body, physical body. And then after that, virama, melody, rhythm. Our body become in line with universe, so we can hear our inner voice like that, and then we can learn how our body works like that. After that, we can find vichara, how we can share our voice, our opinion like that. Virasa, how to share our emotional, love like that, compassion. And then Wibawa, inner beauty. That is the 5 benefit when we do Balinese dancing for few times, like 21 days, 42 days, 210 days like that. We have cyclic days. So if we repeat this dancing for 45 minutes every day, and then we do every day like a yoga asana, until 2010 days, and then our body, our mental, emotional will change, will improve. So if we make a collaboration with conventional medicine, this cancer patient, we will offer to start dancing. They will hear the sound of gamelan, gamelan, and then they will start dancing, and then after that, hopefully they will cure themselves. So from this project, we start from this month for weight management, yeah, slimming journey. We also check blood. We check the sugar level. We check A1C. We check lipid profile like that. Also vital sign, other vital sign, and then we will check every few months until the project offer finish at 90 days. 90 days. And then we will check again the marker, how they improve and how the condition getting better. We will do for the cancer patient and using a traditional concept like that. We also offer like this. Our greeting, yeah, Om Swastiastu, yeah. Swasti mean health, happy, welfare, like that, yeah. We know our Balinese symbol, swastika, the cross, yeah, up and horizontal. Up mean our energy pattern start from the bottom until head, yeah, and then the horizontal our birth and until death. So start from the birth and then you death. You do some exercise to improve your energy pattern. Then the peak is love, compassion, like that. That is the purpose of Balinese people. And then how to make this happen? We start dancing. We make offering. We do water purification, like that. In Tirtampul, maybe you remember, yeah. And then the inner exercise, we also do pranayama to clean our energy channel, yeah, like this. Out, in, like this. We do minimum 10 minutes, and then after that we do Aum vibration. For the lower abdomen, lower body, U for the middle body, for the upper body. Here for Brahma, the creation and the science. Here for the welfare, Vishnu, Lakshmi. And then here for the Shiva, for recycling. And then we do, this is vibration for healing, self-healing. So Om Swastiastu is not only greeting, but this is the way of life, our ancestors. So we will make this integration with conventional medicine and then make a small research how the marker, the blood marker, change after the duration of exercise, like that.
You know, what I love about what you're saying, again, it's, like so many things come into my mind. One of those things is that, as you said, it's this combining, these two, east-west, west-east, combine it together, but you're also testing, right? So it's not that, and please, this is not me being serious, right? But you look at someone and say, look, your aura today is looking a bit off, but how do you know? Can I measure that aura? Maybe there's ways I can, maybe there's ways that I can't. But with science, you can measure it. As you mentioned, these biomarkers for the blood. So after 30 days, 60 days, well, hang on a second. It was here at this point. Now it's there, and now it's here. So you're getting this reinforcement is one, which just hits me very well. The other thing which you mentioned, which you, Dr. Patra, mentioned before as well, was that when people do get cancer, it's mental, actually. And so a lot of it happens mentally, where people just begin from the inside out, begin to dissolve. And then if your thoughts are going in a downward direction, then everything else tends to follow it. And Tracy, help me out here. So the advisor to the Balinese government for traditional Balinese wellness and traditional Balinese medicine, Professor Gelgel, we're a Sutta, toxicology background, right? And we asked him this question. And I know Tracy will bring this back to science in a minute, but we asked him this question on the show saying, what is one of the most important things that health is kind of determined by, that people forget, right? And what he said was the way you think, right? The way that you think. So in something like cancer, I think that's extremely evident, right? As you said, when people get cancer, that diagnosis is like, oh, the body goes down, the shoulders go down, everything goes down, right? And everything follows. So by addressing that with all those different modalities, which are Eastern, to bring that back into the body, it's great to see that combined then brings those biomarkers back up. People feel better, and now they're starting to be well again. So they're the things which just come into my mind. I'll pass it over to Tracy as well. So Tracy, I know there's something you want to add to that. What would you like to add? Please feel free.
What was the question?
Yeah. So we're talking about, bringing wellness back into the body and the infrastructure. Yeah.
The reason we're starting with medical right now is that when there's an issue, and I'm saying every Balinese and every Balian, if they get a diagnosis, they panic, they don't go to Usada, they're running to the hospital. So what we're doing within the hospital, creating program, we can get the baselines, find actually what's happening. So when we're talking functional medicine, we're talking root cause, what's actually causing it, find some priorities, see what methods we can quickly unblock it in the triage, or have to use the Western way, and then we segue into the others. We integrate it that way. But the issue in the past on a national level for Indonesia is that people haven't trusted hospitals. So we just had 1 week with a team up there in Ari Canti. It's a lovely training room. And I'd like to say that Bali has got 6,000 doctors here as well, that now that we visit each certain chosen hospitals, they're all eager to learn too, which is lovely. And that's where we start with doctors, is mainly the mindset. They already have the science, they understand that. Now they just need the tools and the programs. So what we're saying is, the other thing is what's being Indonesia and Asia with Westerners, it's always been an issue of hygiene and sterility. So we have professionals, expats here who are scientists, who in their field they do surveillance of microbes in hospitals. So this is something that we're about to offer the teams here in Bali, as well as a pilot that we can make sterile, like say surgery or theatre rooms. Something Australia doesn't have, by the way. So these are people from all over the world that actually live here in Bali that have got this skill. So that's something that we're in the motions of sharing. The other thing that meeting one of the hospitals with Dr. Patra Bali Mandara, and even seeing their radiation clinic, not that I'm into radiation, but what we're saying is the experience of the patient, because we're all into patient-centred care. I've never seen a radiation room like that. If you know, it had murals on the wall with peacocks and animals, and an area where a patient would have to be locked up for some time. It could be quite a scary situation, but these are the thoughts that the Balinese doctors and the medical system here are thinking about, which is huge as well.
Yeah, so what I'm feeling now is we need some questions from you. It's because, look, we've pretty much done the 3 questions already, right, which is great. So what we'd love to do is actually to hear from you. So what I'll do before that is I'll ask Dr. Patra, Dr. Oka, Tracy, if there's anything else that they'd like to add towards this topic, and then we'll go to his questions. But so if you have questions, remember, just raise your hand. We'll take that third mic in a minute. Now, these questions, remember, today is about infrastructure, Bali's medical infrastructure, and integrative approach to cancer initiative. So we've spoken quite a bit about that. We've covered that. We've covered what the differences, the similarities in the traditional model with this hybrid model, bringing West and East together. We've also discussed, which hospitals offer which treatments. So perhaps we might go into a bit more depth about that in a minute, so people know which hospitals offer which treatments. But yes, any questions that you might have. So I'll give you an example to get us started. So last time we had this, we had a friend who he was going in for shoulder surgery, and he got the X-rays, and most people were telling him, he's a Scottish guy and lived in, I think, Australia. They're saying, go back to Australia. What are you doing having this in Bali, right? He goes, no, I'm going to have it in Bali. So what he did is that he did a bit of research on the doctor. By the way, no one knows what I'm about to say. So they're like, what is he going to say? So what happened was that he did the research, and this doctor was an international doctor who also studied in Singapore, but they also were working out of Siloam, right? So he got the WhatsApp number of the doctor, right, and so who was doing the operation. So he was in constant communication with her. It was a her. And literally before, during, not during is you know, it was under, but after as well. And he said that it went beautifully. Like the whole way through, he was able to ask questions, to get information. Recovery was great. Afterwards, you know, he didn't want to feel any pain because it's keyhole surgery to recover the shoulder. Literally, shoulder's hanging off. Keyhole surgery. Usually, I think there's a bit of pain associated with that afterwards. And he said didn't want any pain. So literally, he was also able to have some level of communication with the person, saying, "Look, I'm in a bit of pain. Could you increase the dosage?" Of course, making sure that it was safe to do so from their side, not just his. But again, he said he had a tremendous experience. Right now, we've also had people here that haven't had a great experience as well. Right? Let's be straight. It exists also. And part of what we were talking about last time with this was that, you know, these things take time as well to work their way through the system for it to be, you know, the retraining that we spoke about, the reskilling that we spoke about. But there are improvements there already, and people are, and he was very happy he didn't fly out, right? His name is Peter. If you're watching now, Peter, I'm sorry, but I asked you if I could use it. He said, yes, I could, so that's fine. But yeah, so any questions from you, they don't have to be, they can be questions which are difficult questions as well. It's okay. So just raise your hand or think about what that question might be. But what I'll do now is go back to Dr. Patro, Dr. Oka, Tracy. So we're not finishing yet, but is there anything else, you know, that you'd like to add that maybe came up when Dr. Oka was speaking, or Tracy, that you'd like to let people know about? Please feel free.
Okay. Maybe I would like to inform that someone asked to me, why you start to explain or to give from the outside of Bali about the potential, about the infrastructure of the Bali and the capability of the services in Bali. Yeah, we are in Indonesia, there is a regulation to make that hospital, there is a little bit, they can give information free about what is they have in the services. Yeah, we call that ethical promotion hospital. This is the problem. So one of the reasons we built the Bali Medical Tourism Association, we are under the tourism board. So if what I said before, then please, Dr. Oka, explain your services in your hospital. Yeah, they can explain. But if I said that I recommended Ari Canti Hospital, it's no problem. But if Dr. Oka attract the patient, come to the hospital, maybe sometimes there is ethical. Yeah, so this is the first. And the second, that our government support us to create the health tourism program, because Bali is depend on the tourism. And one of the problem of Bali is about the safety in medical aspect. So I hope that we still ongoing process, that there is maybe a call center, that if everybody have a problem with the health, they come to the call center, and I will give a recommendation which is the hospital or clinic and etc. will be there. So this is important, because including when we start this program and open border of Bali, when the foreign people come to Bali, so they know that must be have a quarantine program, must be have the PCR examination. So they come, they don't know who will be take handle the program. So I from BMTA will be ask the hospital, the clinic, there is someone they have already paid. You come and you make a quarantine program and PCR test. So this is maybe, I hope that in Bali we completely begin with the people who come to Bali as a tourism, they have a problem in their health, or the people who would like that they have a problem, health problem, come to Bali where hospital or clinic will be handle them, to give a treatment with the international standard. But we would like to make differentiate with integration the Balinese traditional medicine as the concept that we have the we have from the beginning, but once again we don't have the clinical trial or evidence base. So I think that this is start point. What is Ari Santi do? That to make the evidence before and after program. What is the program influence the condition of the patient like this? Yeah.
Wonderful.
Yeah. Okay.
Thank you. Dr. Oka, is there anything you'd like to add to what you've said already?
Yeah. We will make the project, this project, West and East, sit together, to help people get health, better health. Like that. West and East sit together to help people like that. That is the main in my mind, in my concept like that. And then we feel, we understand that Balinese traditional model not yet evidence-based. How to make other people trust with this model. This is the problem. Even our doctor, Balinese doctor, they will not easy to give the patient recommendation. Please visit this traditional clinic and take this therapy. This is our burden also. And then, first of all, we ask Ibu Mudi, Ibu Tracy, how to make evidence-based. So I found the functional medicine concept as the basic layer of this knowledge, Balinese technique, from functional medicine. And then after that, we know about vibration medicine from the doctor. Dr. Widya, Dr. Widya said, Mudi, Dr. Widya said, that's technique is a vibration medicine. She said like that, and then also we need the knowledge, we need the skill, we need the workshop for the doctor, and then our doctor, conventional doctor, easy to accept this traditional technique, and then we will make the like curriculum like that, or the pattern like in conventional medicine, how to make diagnose, how to make treatment. We will make this pattern, and then what will we check before and after, like we said before, the lipid profile. Maybe if you are not yet get disease, or maybe only stress biomarker like malondialdehyde, we check before and after exercise, after therapies. Malondialdehyde, if we get stressful activity every day for certain time, they will hike. It will be high. And then after we do some relaxation technique from traditional technique, and then the level of malondialdehyde will decrease. Your sugar level not yet become disturbing, lipid profile also still normal, everything still normal, but your malondialdehyde already changed. It means you have stress level and your blood mentioned about that, objective, like that, So we need science to make everybody, our doctor also, conventional doctor also, to trust this technique. How to explain this technique in the science paradigm, like that. we need like that.
Yeah.
We need this support. Yeah.
Yeah.
How to learn, how the expert come to Bali, we learn together like that.
Love that. Thank you very much. And, as we're just saying, what you said, Dr. Patre, is so good because Bali Medical Tourism Association is part of Bali Tourism Association. So then having that kind of like a hotline, right, where people can call and say, I have this, and there's someone there to direct them, I think would be a great way for people here to feel confident, feel comfortable, and to be sent perhaps to the right place, for their specific treatment, right? So I think that's wonderful. And I love what you're doing and going into a bit of detail, about how these processes work, and why they work. Obviously not going down to the deep detail, otherwise I think you lose me too. But enough of the detail for us to understand, how, you're bringing that West meets East, East meets West, in a way that benefits the patient. And then also at the same time, being open for collaboration and learning together, which again, Bhinneka Tunggal Ika, unity and diversity, people, right? It's a beautiful thing. Thank you. Tracy, is there anything else that you'd like to add to that?
Okay, so what we're hearing here is the traditional medicine, Usada, in the same way that we talk about Ayurvedic or Chinese medicine, or sometimes they call it CAM, Complementary or Alternative Therapies. In some people's worlds, 85% of healing would happen here. But because in the last 50, 60 years that we've got a medical model, like I was saying before, people are running to the hospitals. So what we have with the testing and establishing baselines, that's our entry point. And we look at the functions, and then we have these other solutions or options for people. But to stabilise so the body can get into a state of healing, sometimes we need to use the modern medicines. What we have now in the last 2 months here in Indonesia already set up a test that we had a decade ago in Australia. They call it RGCC. It's a circulating tumour cell test, which even healthy people can have because we've all in some way got cancer. This test in a petri dish, they can test and see, say you do have a diagnosis of cancer, what actual chemotherapy will work on your cells. Because after you've had 7 lots of chemotherapy and you're not getting through it, in Australia we usually lose the patients. That's what happens. So we're calling this intelligent medicine, where we can actually know what chemotherapy. But the thing is, it's a Greek test. It said, created decades ago, that it not only tested the chemo, whether you could even have radiation, hypothermia, the ozone, it also had all the natural herbs, the mistletoe, and that's where we can start including the jamur, turmeric, that's in there. And like last meetup we had here was Dr. Amin was saying with the turmeric, whereas a chemotherapy can only address one pathway with the cancer, turmeric had, I forget, it was like not 30 pathways, but so long as it's bioavailable and active, you don't know how many active, what we call constituents are inside it. So that's where Professor Gelgel was very much into research and testing the soils here to see what plants here, certain plants grown in certain areas do not have any active things that could heal us. So then we can work out what plants to grow where. So there's a lot of science coming behind this, and with tourism, the medical tourism, I know from Korea, that's always set up with a hospital, usually a grade 5 hospital and a university. And they do the research, and we have ones like Dr. Amin who's used to getting research papers together, and then we can start backing all this.
Interestingly enough, when you were saying about what naturally grows here, that in the audience, he's going to be a bit embarrassed me to point him out, but Sasha over here, they're using moringa. Moringa, which is nitrogenous, it feeds nitrogen into the soil to let other plants grow and flourish, has some incredible antioxidant properties, some incredible vitamin properties, heals malnutrition. Like there's a whole bunch of things, which is kind of coming up. And what they're doing is phenomenal. It's a world-class product, right? So it's interesting how being here in Bali, there's so many things which are naturally available, right? Which, again, come into this integrative model, right, of treating disease. Yeah, to help you to reclaim your own health, which I think is phenomenal. Yeah. Now, are there any questions? Yes, okay. So what we're going to do, Tracy, if we take your mic, because you're at the end. Yes, okay, you can keep your Dr. Oka. So just over here, my darling. Yeah, so I think it's Sasha. So just while we're getting Sasha involved here, just remember with these microphones to point them at your mouth, right? If you hear your own voice, it's okay. Oh, I hear my voice. One of the things as well is that, so Health Hub Bali, which is Tracy here, so Health Hub Bali, you can go there in person. It's here in Bali, in Preranan, Pantai Preranan. So right down the end of Pantai Preranan, opposite Monsieur Spoon, is where you'll find Health Hub Bali. So it's open. Well, they've got website, they've got social media, Facebook, Instagram, and so on. But you can go there in person. They have different events going on, from health markets and so on, where you can meet incredible people like this and get that face-to-face, one-on-one interaction, and maybe very private questions can have them answered, as well as learn, because Health Hub also is a platform for incredible knowledge from around the world, right? So it's this place which is great for knowledge, great to meet practitioners, great to meet Tracy, and obviously incredible to meet wonderful people like my brothers over here, Dr. Patra, Dr. Oka, and obviously your hospital, which we're going to give a bit of a wrap to. Where is it actually, your hospital? Whereabouts is it? Ubud.
Yeah, Ubud.
Ubud. So if you're in Ubud, please give the name of your hospital again.
Yeah. Ari Canti Ubud.
Ari Canti Ubud. All right, wonderful. So, Brother Sasha, over to you for the question. Yeah.
Thank you. Thank you for allowing me to to have an input. And I was scared my question would be unrelated, but thank you, Robert, for the introduction. It's about BPOM. How, if you guys work in relation with BPOM who give regulation towards products, building up this brand of Moringa, I've been facing some issue related to the traditional obat category. And as you guys probably know, the most potent natural herbs are better the less processed. The less processed it is, the more component, nutrient are available in the product. However, into capsules, into traditional obat category, I'm not allowed to put moringa powder as a pure form. I have to make it a concentrate, which obviously is a concentrate, but would lose certain nutrient by the process of it being made. And so by trying to make Bali and Indonesia overall a destination of premium quality natural products, healing products, how can we work better with BPOM and with government regulators to not soften, but to open up to new possibilities or new regulations? Yeah.
Yes, thank you. This is one that our focus in BMTA, because what I said that BMTA under the tourism board, but under the governor of Bali. And in Bali, we have BPOM. BPOM is like FDA, if in America, yeah, BPOM in Denpasar. And we will be, next month, we will be make a special meeting to discuss about because Dinas Kesehatan, health office, Bali Health Office, they have two organizations. They produce the herb of the Bali. Yeah. But until now, not licensed from the BPOM. So this is, I request with the head of the Bali Health Office to make that, because if there is a herb product, the Balinese herb product, but not licensed by the BPOM, maybe about the trust. Yeah, this is the problem. So But because there is a business, so before we are BMTR declared, the head office, the health head office, they cannot involve until the product, because there is a business process. So we are as a BMTR, maybe I'm a association, but under the government, and we can do the business like this. So this is, yes, I agree that the problem is about the license from the BPOM. Yeah, because we have the, the textbook, what we call the thru pramana. There are many plants that can be using for drug like that. Yeah.
And
Okay.
jumping back on the trust also for export to give Indonesia international quality product image, you can't export if you don't have the BPOM license.
Yeah.
So if it's not possible to create this almost raw product, natural product, then you can't export, which
Yeah.
would be a great opportunity for Indonesians.
I think that the first that we must have license from BPOM. After that, we are going to international standard. Yeah. For example, I myself as a chairman of the Bali Blood Bank, so now I have achieved the certification for good manufacturing product from the BPOM. So our process to serve the blood with the quality, safety, and maybe I hope that because this is drug categories, it will be help of the patient like this. Yeah. Okay.
Great question. Tracy, you want to add to that? Yeah, thank you, Dr. Patra. Appreciate you, brother. Yeah.
Yeah, I think there's this issue is coming up quite a bit, so it's probably about making a separate group for that. And it's not just Bali, that's all of Indonesia. And to find out what the standards are, and then, because we want everything legal, legitimate, credible and competent, they're words, so then that we can get the standards right. And that's where Health Hub is getting involved as well.
Beautiful. Another question, yeah, just in front. Yeah.
Hi. My wife and I have just been in Bali for about a month now, living over here for a year or so, but just a couple of comments, and I'll just ask a question. But I think the whole medical tourism thing is a really interesting concept. We're from the tourism industry in Australia. It's not something that we promote in Australia as such, but I think it has enormous opportunity for Bali, which is, of course, so well known globally for health and wellness. It just sort of is the next logical step, isn't it? The full medical tourism destination. So I think it's a wonderful initiative, and integrating East and West and treating the whole body just sort of makes sense, doesn't it? Really. But my question is around where you're at on this journey. Like, are you already? You talked about doctors being trained up around Bali, but is it already in some hospitals, this integrated service, or is this a vision for the next 5 years? Where are you at on the journey?
Great question.
Yeah. Maybe in implementation, Dr. Oka will give more information. But I said that the governor has already declared the regulation, special regulation for the Bali traditional medicine integrated with the Western medicine. So all of the government hospital around Bali, they have already start to integrate it between the medical conventional with the Balinese. And for the private hospital, I think that Ari Canti and Kasibu, they are two. Yeah.
Ari Canti and Kasibu.
Kasibu dan two hospital, the private hospital. And I think that this concept for medical tourism, it's not now, maybe before COVID. This is start from the Minister of Tourism, not from the Minister of Health. Yeah. So they are talking that we must create the health tourism program like this. But the Minister of Health still they are thinking only the medical conventional like this. Yeah. So only thinking that the sick people will be coming from one place to the other place. It is a little bit crowded or difficult like this. And maybe the main problem is about the mindset of our doctors. Because this is, if we do my experience when I'm a CEO in Bali Royal Hospital in Bros. So even though I have maybe 3 plastic surgery, not all of the plastic surgery doctors can follow the program, because they must be the first that influence the people to come to Bali for like cosmetic surgery. Yeah, this is the important. Because before the doctor, I don't do like this, the people will come to me like that. So there is a thing. And when COVID, so now everybody thinking about the health. Yeah, health lifestyle like this. So, and then after that, we declare for BMTA. We make the BMTA. This is the like organization to share, to communicate each other, because before in Bali, so every hospital do by themselves. So now we make a collaboration and etc. like that. But we looked at maybe to attract the sick people come to Bali, we must have data. So we start with the integration from, for example, cancer from Ari Canti to have data, and then I myself will be show for the other people that this is the result of that. But the other side, we start to promote the medical wellness. This is the healthy people or the people with the risk factor. They follow the program, the health program, but not all of the program do in the hospital or clinic. We will do in the resort or in the hotel or in the villa. So our team will become to resort, hotel, or villa. For example, for the mental health, wow, there are many people with the anxiety. So not the people come to hospital. They will be going to maybe the clinic of the mental. So this is the stigma. Our team will be give like some question and etc. And then after that, our doctors and team will be come to the resort. So can communicate maybe opening and etc. like this. So we try to make that the sickness atmosphere is very, very minimal. So why we call that this is the health tourism. So we would like that tourism will be make that the condition or situation is not like a sickness atmosphere. Because the people come to the hospital, they will be the health people will be together with the sick people. This is the problem. Yeah. And then we looked at, we have capacity to make that with the concept hospital without walls. So the team of the hospital coming to the villa, hotel, resort, and etc. Like this. Okay.
Now, I know that you want to add, can I quickly just say something which is, it's amazing, right? So you've got multiple protocols happening at the same time. So one thing we haven't spoken about, because you've just arrived recently, is the special economic zone in Sanur, right? Yeah, so you have Tracy will explain, or one of the guys who will explain, 2 international hospitals, including Mayo Clinic. So it's a special economic zone around that, which obviously then makes it easier for international doctors to come and practice, and so on and so on and so on. That's one protocol. But then there's another protocol, which we've been speaking about tonight, and help me if I'm wrong, which is the hospitals which exist outside of that zone. How do they re-educate, re-skill, and so on, which we've spoken about. Then there's another protocol we've just spoken about, thank you, Dr. Patra, which is, again, it's, well, now you have these, which is what Health Hub is involved at every step of the way here, which is, right, so then how can we create wellness retreats, resorts? right? Which is where your mum comes in, Sasha. Blue Karma Resort, it will make sense. That's his mum. There you go, right? So basically, now what you've got, and I don't know all of it, right? I'm the non-smartest guy in the room, remember? But that's 3 different protocols that reach those 3 different markets and service each one in a beautiful way that's still integrative. It's amazing. Tracy. Maybe I said what you're about to say.
I forgot what I was going to say.
So
one of the things, like with Dr. Patra was saying, like even this week I had one call from somebody young from Australia with a lung disease. They can't operate or do anything. They've been in Mexico, Germany and a few other places. We're saying, come here. And that was years ago when we started this series, was if you have a diagnosis, get out of wherever you are, come here. Sometimes it's just the environment. We have 120 days to turn your cells around. We check that. We check out actually what's causing it, and then we start implementing it. And we do the same things. The machines here basically that Germany have got, we've got all that here. And what we don't have, we've got access to get it. We know the pathways now all the time. But it's about connecting. It's such a big country. It is... I say there's 300 million people here, and you don't want to lose track of how many doctors there are. There's amazing doctors here. And even this other project in Sanur will have that team on here as well. They've reached out to Health Hub as well, and that will be, you can hear what's happening there. But they've only got 200 beds. But the idea is we integrate it into the health medical tourism system. And that's where in the hospitals and in the hotels, we have programs for their medically informed retreats. Because what's happening throughout the world is people are getting diagnoses in 2 months to live, and they're quite young. Or they're old or whatever, but it didn't happen yesterday. It's already been there for 10 years. So there's a ton of testing, simple testing sometimes, that we can look at indicators. And most of the diseases the doctors are saying now are lifestyle. They're not a diagnosis, whether it be heart, diagnosis, cancer, whatever, and the patterns that we have. And they can be generational, but we've got enough science and tech and natural things to be able to turn this around and what we call reverse engineer.
Dr. Oka wanted to add something there, but I'm sorry, brother. You're there, and I was like, but it just kept coming. I tried to stop it. Over to you.
I will give some information.
A bit closer.
But why we do this initiative? For us, private hospital, there is no obligation to follow the government instruction to establish traditional Balinese medicine, because that's only for government hospital like that. But from my opinion, conventional medicine, until at a certain step, cannot help people how to restore or how to get back to the health condition, to the wellness condition. And then Eastern science, Eastern knowledge can do, such as Balinese knowledge. In our tradition, we have many manuscripts, we have many scripture about anatomy, about how to the body function, physiology, how to the disease come out, the sickness come out, and this disorder come out. We have the text about that, from the text about children, geriatry, senior, like that, for the skin, many texts about that. So we need to up this text, learn again, and with the science perspective, not only for from the traditional perspective, from the science. I think functional medicine, vibration medicine has the place to study our text, our tradition, like that. As you mentioned about moringa, we feel also the same condition. So in this hospital, in Ari Canti Hospital, we make collaboration with Sido Muncul, the biggest jamu herbal factory in Middle Java. So we can make Simplicia. We can make Simplicia from a government institution. We buy from them, and then we mix at our hospital and then give to the patient. But if we make herbal, standardized herbal, there are many regulations. So we join with Sido Muncul. There are many herbal standardized, and we use that product. After that, if the doctor want to use advanced product, we call this phytopharmaca, ya. Simplicia, herbal standardized, and phytopharmaca. Herbal standardized and phytopharmaca come from Sido Muncul. We put that remedies in our clinic. So if doctor want to use, they will refer to make this remedies like that. So we feel also the same condition about how to make this international standard, how to export, because we not yet go to that step, in Indonesia. And then back to Tracy mentioned before, Usada, like the word Usada. Word Usada in Bali mean cleansing. How to get back to your health condition, you have to cleanse your detox your blood, detox your intestine, detox your energy channel, like that. And in traditional system, there are many ways to do the detox. And we find also at functional medicine as a ozone therapy and before chelation therapy, like that. So we can do collaboration, science, Western science, conventional medicine, and also East traditional, Balinese traditional medicine, like that. So this is our hope, in the future. Is it already happen or still our vision? Already happened. Start from July last year. We make the small clinic at hospital, inside hospital. We go to the village. We come to the people, and then we educate the people about this is our traditional approach using herbal. We have steam boreh herbal. We in Balinese tradition, many herbs we put and then we squeeze and then put on your skin. But today we not put on your skin. The herb we squeeze and then we put on the boil, and then boil become steam, and we send to the skin at the acupoint. Send to nadi sweda. Sweda mean keringat. Sweat, nadi sweda. Jadi nadi mean channel, blood channel, lymphatic channel, nerve channel, pranic channel, nadi, and then sweda, sweat. So we make sweating on your skin using herb, this herb. Is there any evidence base? Not yet. We need help. The scientists come to hospital, we do research, and then upload to the journal, international journal, and then this modality of therapy become familiar to the people, like that. So we start to start clinic in-house hospital and then go to the village. Right now, people come to the hospital asking to remedies, asking the treatment. But the doctor, our doctor, conventional doctor, not yet agree, not yet ready for this approach. So right now we go to the doctor, tell them this is our Balinese style. You can send your patient to our clinic, so we can make collaboration. And they start. Few doctor join this project. They send the patient maybe low back pain, vertigo, dizziness. Maybe vomiting, they come to the clinic, we do. Last year we do a project for athlete, swimming and diving athlete for performance, combine doctor and traditional technique, and also dancing. And then this month, from last month, we start slimming journey, collaboration also. And then at the middle this year, we will start from the healthy young people with the project using dancing, herbal, water purification, few techniques, simple technique of meditation and Balinese yoga. And then we will make observation what happened before and after. That is the initiative. Still far from the evidence, still far from the what we vision that West and East sit together to helping people getting wellness like that. Thank you.
Wow. You know, the last 24 of these episodes, you know, again, I'm a learner, right? I've learned so much. And just hearing you speak, there's more things that go in. So thank you to everyone. Dr. Patra, Dr. Oka, Tracy. It's been what a journey. 25 episodes of these over 2 years, more than 2 years. We sat down 2 years ago and said, Tracy, I know what you need to do. You need to do this once a month. And the tremendous growth and acceleration on all of this, government and meeting wonderful people like this. We've met pioneers of technology, Dr. Dan and everyone else. It's been phenomenal. What a journey. So I think we're getting to that point where we can kind of wrap it up for this one. I think we've gone way beyond these 3 questions that were on here, that's for sure, which is great. And it's great to know that, you know, we have some guests from Australia, right? I didn't know you in tourism. Thank you. We can definitely chat. We've had Sasha over here who's doing incredible things with Moringa, Trilogy, and obviously Blue Karma Resorts. And again, we had some, I don't know what you gentlemen do. I'm going to have a chat to you later and I'll find out more. So it's been a really interesting episode. So look, I'll give you some time. So just some closing thoughts. It can be very quick if you want. It's okay. Things that maybe you'd like to close with, or things that maybe you would like to say you haven't said before. We're finished with Tracy at the end. I just want to say thank you to all of you for coming. Thank you to Tropical Nomad. Tonight we have Guzman, we have Hadis, we have Sister Ayu as well, which is great. Next week's show is welcome back to a friend, incredible man, whose his wife is from Indonesia. His company, I think, is the largest company now. When we interviewed him the first time, it was the 3rd largest. Now I think it's the largest company in the world, which removes or facilitates the removal of CO2 from the atmosphere. So he'll be here next week, a one-on-one interview. Fascinating guy. And his company is phenomenal, but he's just a beautiful human, you know? So that will be a great conversation. Back here next week, 6 o'clock for 6:25 start. Just remember that tonight's episode, the first Monday of every month, we look forward to, is Health Hub Bali collaboration with incredible people like this. So again, we're not done quite yet, but thank you so much again, Dr. Patra, Dr. Oka, Tracy, thank you so very much indeed. Remember Health Hub Bali, go there in person. It's in Pleranan, Pantai Pleranan. Just go right to the end. Just check where Monster Spoon is, directly opposite. That's where you'll find Tracy and the team. So, some closing thoughts. We'll go in reverse order. So maybe Dr. Patra or Dr. Oka, and then we'll finish with Tracy.
Okay, Robert. I will be always said one sentence: learning by doing. So yeah, we know that this is the project or the activity is the big activity with the complexity, because we can't do by myself, because we use the pentahelic concept too. There is government, private association, community, and etc. like this. So we said that learning by doing. This is what is Dr. Oka explained. We are not only talking, but have already run in Ari Canti Hospital. Yeah, because we know that the first we must be to change the paradigm, not the community first maybe, in the health human resource, special doctors, because sometimes many doctors thinking only the conventional medicine, but in this concept still that we using the basic of the medical, the people who would like to follow this program must be to meet first with the doctors, So not, even though there is a traditional medicine, but the first they will be meet with the doctors, and then doctor will be describe about the program. But maybe I don't know, but I believe that will be happen in Bali. There is a West medicine, there is a traditional medicine, like maybe in China, in Korea, and etc. like this. So this is my dream before. Yeah, thank you very much.
Beautiful, brother.
Okay.
Thank you. Yeah, round of applause for that.
Yeah, health is our right, yeah, and we are destined to live healthy, and then we have to know our body, how our body works, and we can learn from many sources, such as right now we learn from Balinese source how to become how to stay healthy with this technique like that. How you can dancing, you can painting, you can make carving, and then you give offering to divine, so you can live happily like that. Thank you.
So these are the journey, learning to live in Bali. But before we start the journey, it's about establishing the baselines. That's where we started 2 years ago. The future of medicine, or the future of health, is science. It's personalised and it is preventative. And it's every day of our life, which is really the way Balinese live. It's the harmony, what we've learned from all you guys too. So what we're creating is a model here to reset and restore, which may require some detoxing. That in Balinese it's purification. In the West we say detox program before we even start with somebody, but we establish which systems are broken, and then we can draw from the different models. And if someone has a serious diagnosis, we want to take the fear out of it. We don't want them to be scared of it. Cancer cells are quite beautiful, they just multiply a lot, but there's something they need seriously to address, and it may be, we say 85 in the mental part, but even the breath work, we address all the endocrine nervous systems, so they can get into a state they can actually heal, and that's where we pull from the traditional modalities.
Thank you very much. Round of applause, everybody.